This is Remember the Prisoner in the age of COVID-19. We want to talk today, we're going to talk today with Vicki Reddy and with Stephen Chu around the criminal justice system, and specifically around mass incarceration. And the COVID-19 is one symptom or a major piece right now that's happening, but it's in a system that's already broken, right? And so this has been exacerbating some things that have already many things that are already a part of a system that needs to be reformed. And so we want to acknowledge up front too that mass incarceration primarily affects the Black and Brown communities, and that is the highest number of people incarcerated in our prisons throughout the United States, as well as Native Americans as well. And in this call, I'm a host, not an expert, but a host, and glad to be continually learning, and recognize also that it can be challenging to have advocates who are not Black and Brown or Native American to be speaking to these issues without that representation. So we do want to acknowledge that and thank you for being with that. But I've invited these folks and folks of faith because of what I've learned about their background, and trust that there'll be a lot that they'll be able to share with us today. So thanks for being with us. So I would love to start with maybe Stephen and then Vicki. Would you guys introduce yourselves, please?
Sure. My name is Stephen Chu. I am currently a lawyer in New York City. I do appellate lawyering, which is that I'm a public defender for people who have been convicted of felonies and sent to state prisons. So my clients that I work with day to day are actually generally in the prisons. And we look at their records and try to figure out if mistakes have happened with their sentence, with their conviction, and advocate for them. But a lot of what we do is from a holistic standpoint, which is trying to understand what it means to work with clients who are going through the trauma of incarceration. And especially, like you said, during this time when COVID exacerbates all the brokenness of the system. These are questions that we're thinking through right now.
My name is Vicki Reddy. I'm the Assistant Director of the School of Restorative Arts, which is North Park University, the seminary's prison education program. North Park University is based in Chicago. And we run a master's degree program inside the Stateville Correctional Center, which is a maximum security prison just outside of Chicago, and are looking to also run programs in some other prisons around Illinois. But I've been doing that for the past 3 years. So I go into a maximum security men's prison 3 days a week, prior to going on lockdown because of COVID.
And Vicki and Stephen, please feel free to keep your mics open because we'll have a question and answer period towards the end of the conversation. About 1:45 or 22, and but you two, I would love for you guys to engage back and forth. So feel free to keep your mics open. Everyone else will get into the conversation. Great. So we would love to hear, how did you both get involved, your individual stories, in advocating alongside incarcerated communities and their families?
Okay.
Vicki.
Thanks, Stephen. I ended up studying through North Park Seminary. By default, I joined a program a certificate program in transformative justice. And the professor, Dr. Soon-Chan Ra, who many of you may know, said to me, you just have to take it inside a prison. And so I said, okay. So I started without an intention of getting involved in the criminal justice system or with incarceration, and then started 1 day a week at the prison alongside incarcerated men. So very quickly I realized the state of of injustice in the criminal justice system, ironically, and found that I couldn't be going in and learning alongside these men who quickly became part of my community and not be advocating in ways that they can't themselves. So using my voice to amplify theirs, and speak into systems that that continue to oppress them. So really via proximity, by being alongside them, coming to know people who were incarcerated, and understand how the system does oppress them, and realizing that I can choose to engage it or ignore it.
Stephen.
I started going down this path actually as a university student when I was in college, and I attended a urban project. I know we have somebody in our audience today who has a lot of familiar with urban projects, but I did the City Lights project in St. Louis for 2 years when I was in college, and started realizing that living out my faith and understanding the issues that being a Christian meant in cities like St. Louis and cities across the country meant that I need to think more deeply about issues of race and justice. That led me to go down into law school, actually, because I was like, okay, let me learn some tools on how to actually impact these communities and these issues of racism and poverty that I'm seeing. I got lucky enough to go to NYU, where I had a professor named Bryan Stevenson, who many people have heard of now, who talked at length about what it means to think broadly about these issues in terms of our history of incarceration and slavery and our history of segregation. I worked with other professors who were able to teach me about how to do this from a community aspect, from a client-centered aspect. And then I was lucky enough to have gone down and actually worked at the Equal Justice Initiative in Alabama, doing death penalty work for about 7.5 years before I moved back up to New York City. So that is sort of my history, but I've been privileged to have a lot of mentors and leaders who have influenced kind of how I've been trying to connect this work to my faith. But it did all start with university.
Great. So can you tell us even more, dig down a little bit more your stories about the areas that you concentrate on, Stephen, with the appellate work that you're doing? Can you tell us more about that? And also, Vicki, some of the work that the Restorative Arts program does.
Yeah, I think I'll start talking a little bit about the EJI work, the Equal Justice Initiative work that I was doing, which was death penalty work, but also working with children sentenced to life without parole. And I know a lot of this has made the news lately with the movie Just Mercy, with the book. A lot of people have read these issues that we work on. But doing that work helped us talk more deeply about the humanity of our clients who were sentenced to really long sentences, whether it's death or whether it's death in prison, and trying to understand what it is about our clients and how to develop relations with them. I think that flowed in two directions. One was, like I said, the history. So understanding how these systems work, and that it wasn't just individual cases, people doing bad things and getting sent to prison, but that a lot of these policies that we have around mass incarceration are rooted in historical concepts of slavery, that the counties that did a lot of lynchings were also the counties that did a lot of death penalty sentences. And so how did we situate our work with that historical perspective? And I think one thing that Equal Justice Initiative has done is to create a memorial and a monument to the sort of this progress from slavery to mass incarceration, but also to the victims of lynching, because we recognize that understanding our current situation of mass incarceration in light of our country's history is vital to figuring out how to move forward. So that was one direction that I pushed. The other direction was to really think individually about our clients and the trauma that they had gone through in their lives to get to the position that they ended up having to work with us. And that trauma is manifold. It deals with adverse childhood experiences. It deals with needing to learn more about the law, but also learn more about people and psychology and social work and everything that helps us understand what it means to go into prisons and interact with clients who are desperate for some kind of person to value their humanity and their and what they bring to our conversations. And I think going in with a level of humility to understand that we are not there to save our clients, but we are there to partner with them and to learn from them and to recognize that they have stories that our systems have not acknowledged. All that has then transformed me into my current job, which is not just working on the individual appellate cases, although that is what I do, but to realize that it's not just death penalty cases, it's not just the children being sentenced to life without parole. It's that all our clients in prison, whether they're in there for 3 or 5 years on a drug case, whether they're in there for 10 years on a robbery case, or that they're in there for life and they need somebody to grant them parole, that these factors of history and trauma and all these conditions still play a role in what it means for our clients today. And so my day-to-day job is very much to look at their individual case and look at patterns of racism and patterns of injustice and judges who don't care and judges who are comfortable sending people to years and years in prison, and try to do something within the system of our law to rescue them and to fight for them. But I think it's also a very real recognition that outside of the law, we also need to be talking about the deeper fundamental factors that are behind mass incarceration.
Mm. Yeah, I echo everything Stephen just said. For me, the School of Restorative Arts intentionally went into the prison that we're in to work with those who are considered long-term offenders. A lot of the programming in prisons are for those people who are getting out soon, and rightly so. It's equipping people who are going to be coming back into society. But for those who are in prison, either for life, as Stephen said, or they're either on we don't have the death penalty in Illinois, but we have death by imprisonment for those who are in for life. So everyone in our program has at least 15 years still on their sentences, and most of them have been inside for at least that long as well. So we're talking about mostly kids who've gone in, as you said, Diana, black and brown. I think there's 3 or 4 white guys in my whole class of 40 guys. When they were in their late teens, in their early 20s, as we know from brain science, their brains are still forming. They're the product of the environment in which they've grown up in. They've made a decision. Maybe they didn't. Maybe they just happened to be in the wrong place at the wrong time, or they've been framed, or they legitimately, for most of them, they did what they're in there for, and they've grown up. And they've become adults, and they're no longer the person they were at 18, 19, 20, a product of an environment in which all they know is one thing, when all you know is gangs, when all you know is guns, when all you know is alcohol and drugs. It's so easy for those of us who don't grow up in that environment to look at it and go, well, you should have known better. But we know what we know because that's, I know what I know because that's the environment I've grown up in. And when there isn't an alternative, it's a lot harder than most of us or others who didn't grow up in that environment look at it and judge. So for me, quickly I realized in advocacy that there was a lot of advocacy around in the criminal justice system, and especially in Illinois, in working toward decarceration and getting parole and all of those things. But the problem was none of those things were impacting any of the men in my class, because they're all convicted of because they're all considered long-term offenders. They're either on life sentences or they were sentenced under truth in sentencing laws, and so they're at 100% truth in sentencing, which means that any laws that are being enacted, any parole bills that are being put in, we don't have parole in Illinois, they're not eligible for, because they're under 100% truth in sentencing. So that became very quickly my focus of attention. How do I advocate for these men who are excluded because they're violent offenders or they have violent convictions? And we're seeing that so clearly now, especially in Illinois, and I know in New York and in other places, where the discussion around releasing people from prison, it's always the non-violent offenders. But the reality is that actually, and this is by far my experience, the men that have committed violent crimes or are convicted of violent crimes, who've been in prison for 10, 20, 30 years, are the most low risk. And this is I'm not making a general statement of everybody, but by far, a lot of these men and women in the country who have been incarcerated for violent offenses have generally made one mistake or a couple of mistakes that they've done in their youth. They've been put away for long periods of time, and they're the ones who we should be releasing now, because for many of them, they have been rehabilitated, they have been transformed, they are adults now, not kids that they were when the crime was committed. But we so easily just say, no one who has a violent crime. And that is the language that we're hearing by politicians and by those who are against decarceration, because it's an easy narrative to sell. And it's difficult for that narrative to get changed. And so that's what I've been committed to doing, is telling the stories of my classmates, is getting their voices out and their stories out, and trying to change this perspective that we have that violent offenders should be thrown in jail and the key thrown away. Because it's unjust, and it's an aspect that I think it's easy for us to ignore.
Yeah, and I'll just jump in and respond a little to that,
yes,
which
please.
is that I appreciate focusing on the label violent crime or violent offenders, because that is just a huge problem in the narratives that we talk about these days. And I think to point out that going in and our work with our clients is not, again, I think I mentioned this before, we're not doing it because we're saviors. We're not doing it because we have a goal to redeem those who are broken. It is that we actually understand that people changed. For us who are on the outside, we definitely understand that anything we did at 18 is not the same kind of thing that we would do right now. I think what Bryan Stevenson always says is we're more than the worst thing that we've ever done. And I think that is true for many of our clients, that they age, that they mature, that they grow, and they are different. But yet we are so comfortable as a society just labeling them as a murderer or as a whatever they have done in their past, and being comfortable to think that they will never change. And I think so many of our policies are built on that, and it's just not a proper understanding of people.
Yeah, that's so helpful for both of you shared. Because I think about, especially as people of faith, that's a huge part of our narrative, right? Of ever being able to change, that come to Jesus and he will change you, right? And so, and how many of us as people of faith, that's our continuing narrative of, oh, I'm not the same as I was yesterday. That's what you're right. And I hope I'm not the same person that tomorrow that I am today. Like, we're always encouraged and striving to become closer and closer to Christ. Like, that we never want anyone to just remember us as the way we were, especially our worst moments, right? But not applying that to others just seems so contrary to our faith. So it's really helpful to think about that and to remind us, especially as labels matter. Which makes me think of, yeah, I was just, and that's exactly what I wanted to do. That's why I wanted to spark conversation. Yes, please.
And I think that, and this has been the biggest thing that I've learned in the past couple of years around prison ministry and around Christians, and how I think that we do, clearly, because we have such a focus on prison ministry in Christian circles, we do have this idea that people can change and be transformed. But for some reason, when it comes to those who are in jail, the focus is on, yes, we're coming in, we're giving you Jesus, we want to get you saved, but you have to stay where you are. There isn't a holistic transformation, restoration, rehabilitation. So it's not even a fully living out of our faith. Because if we do believe that, then we would look at all the things that Stephen was saying with the system, and how broken the system is, and how it continues to oppress and to treat people in a way that they shouldn't be treated. But the majority of prison ministries and Christians who go into prisons are not interested in having that discussion at all. So it blows my mind that such a tenet of our faith, like you said, Diana, is this idea of transformation and forgiveness and healing, and we become new people. But so we see it, but we don't really believe it when it comes to people who are in prison, because otherwise we would advocate for change.
And so that goes the thought about, because even at North Park's program, specifically with incarcerated friends and community, is called restorative, right? Either one of you, Stephen or Vicki, just thinking about the difference between restorative and penal systems. What is it? Why are we? Well, what would be a restorative justice system in your thoughts and hopes? And why is it that, especially as we think about like people of faith, we would separate the two, we lean more into the penal than the restorative, from your experience and thoughts?
Go ahead.
There's a few questions there. I think one question you're asking is why we lean more towards the penal than the restorative.
Yeah.
And then I think there's another question about what would restorative look like.
Yes.
And I think those are hard, like really large questions to answer, partly because they poke at a lot of the fears and insecurities that we have as people and also as a country, that we are much more comfortable penalizing because we fear what we don't know.
Yeah.
And we're not willing to, I think Vicki said earlier, like, we don't understand the backgrounds, we don't understand the histories of many of our clients. And if we were to actually do that, we would have to confront racism, not just in the prisons, but at all levels. We would have to confront our inequity in education systems and healthcare outcomes, in all sorts of things that are not just policies today, but are policies that have been passed down to us from generations and generations of racism and segregation. And to actually confront that is difficult, so we're more comfortable doing what we do currently with labeling people and sentencing people we don't know, we don't identify with, to prison. And I think dealing with that is hard, but I think dealing with that is sort of our obligation as Christians, to really wrestle with what is it about this country that needs to be changed morally and practically. I'll stop there, and maybe Vicki, you can either add or jump on to the other part.
Yeah, I mean, I think exactly what you said about we fear what we don't know, and that's where I think proximity comes into it. And this is my belief of what I think Jesus meant when he said visit the prisoner, is that it's not for the sake of the prisoner, it's for the sake of those of us who do the visiting, because we do go in and we learn something different. I mean, when I was going into class, a couple of months in, I was speaking with a friend as I was about to go into prison, and she said to me, "Go be Jesus in there." And I'm like, I go in here to find Jesus. Like, I don't come in, like, I say often, I think my faith has been saved because of the last couple of years I've had in the prison, that I've come to know God in a way that I didn't know existed, that my faith and my understanding of the gospel has just been so broadened because of the community that I have inside the prison. Jesus is alive and well inside the prison. Those who are in prison don't need us to take Jesus in there. And I'm not saying we don't do that, and there are very valid and good ministries that go in there, but with the posture that we take as we go into prisons as Christians has got to be one of mutuality. It can't be one of, as Stephen says, if we're going in to save. And unfortunately, I think that's what it has been traditionally. And if you read Dominique Gillard's book, Rethinking Incarceration, he dedicates a whole section of the book talking about the background of Christianity and its relationship with the prison system. And the reality is that the prison system became this whole field of people ripe for getting saved. And so we still have that mindset as we go in there so often. But I think that until we get in some kind of proximity with people who are incarcerated, or we learn to hear different stories, we read books like Bryan Stevenson, we watch the movies, we read Dominique's, but we read these other stories that give an understanding of the criminal justice system, of how we got to where we are, and of the realities of all these layers and layers and layers of trauma that have led to people being in the prison system, and then continued layers of trauma whilst they're in there. We won't ever understand it. Well, it's easier not to know, and we fear it. because we've been taught to fear it. And so I think to answer the restorative piece, and until we change the narrative in society where people want to engage it rather than just go, no, that's too hard, I'm not going to look at it, I don't think it will change, because fear rules. And fear says, I don't want murderers running around the street. I don't want murderers living next door to me. And these labels that we put on people that are just not fair and not who they are. And so I mean, for me as well, really quickly, I realized that changing of the narrative was the first piece for me in terms of any kind of advocacy or any work in this space. Because until we, and not everyone's going to come into prison, so not every single person who has come into the prison and met the guys in our program, like, instantly changed and transformed in their perspective, but not everybody is going to do that. So for me, figuring out how to get their voices out in a way that it's not me, it's not me speaking for, but it's me speaking on behalf of and alongside, in a space that doesn't allow them to have their voices out there. So how do I use whatever influence, privilege, etc. I have to provide the pathways for that, so that people can be in proximity with them, even if it's not face to face.
Yeah, and I think that's probably why we're having a little trouble answering the like, what would a restorative kind of system look like? Because, and I'm grateful that we're all speaking from this perspective, because it's often hard for me to speak in religious circles about this because of the things that you're talking about. But that our perspective right now, as we're talking, is that it's not about restoring our clients or our people in prison back to our normal society, but it's like recognizing the brokenness that we all bring to the system and restoring that system at large, which is a different frame, and we need to help bring back these people who are in prison.
Wow. Yes, restoring lives. Yeah, and that's a huge piece of labels that we put on people, and fears. So many things. Restoring lives. So many things you guys said right there. But I want to make sure I'll just like highlight. That was great. Thank you. Well, talking about COVID-19 specifically, what has been the impact of COVID-19? And I'll put this together with another question of what has been the impact of COVID-19 on prisons and jails, recognizing that jails are the entry point and then prisons are the longer term place. So they're, I remember used to equate them as both, or conflate them, right? But they're two different pieces. And what has been the impact of COVID-19 from your perspectives in your areas that you, so Illinois is where Vicky's at, and Stevenson, New York. And for communities, like for your clients, if there's a client that you think about, Steven, who's been impacted, or Vicky from the restorative arts community, how has that impacted even your clients or your friends? I'll start with Steven.
Sure. So generally, I think we are really scared, and our clients are really fearful and anxious, just like the rest of us during this time. And the only difference is that we are able to make choices for ourselves about how to socially distance, about how to wear masks, about how to be protective of ourselves. And when you're in prison, you cannot make these decisions. You are at the whims of your jailers, arbitrary or not. They will decide whether or not they want to punish you. And they did punish people for wearing masks because it went against security. They are punishing people for not being able to socially distance and all that stuff. And there are factors in just the structures of incarceration that our society is generally comfortable with, but in times like this, we really understand how these structures are just inhumane. I think I read somewhere that the leading hotspots in our country with COVID are not the cruise ships, are not these parties. It is prisons. It is meatpacking industries. It is nursing homes. There are places where we have vulnerable people to begin with, and we're not framing this discussion about protecting that. And protecting them in this time is relevant to our public health as a whole, because that is where, we're not going to keep people separate. We're not going to keep people isolated forever. In New York State, we have 45,000 people in prison. And as of, I believe, this morning, they've tested 600 people. And so that's just over 1% of tests. And we know that lack of testing means we just don't have the information to know how to protect them. And in all your states, there are different circumstances like this. And we'll get into more how you can contribute, how you can help. But these stats just signify that people don't care about the humanity of our clients. And I think we're, in my actual work, we're doing a lot of litigation to try to get people home, to try to get people out of prisons and keep them safe. But I think repeatedly we run into decision makers saying, well, we don't want to risk the city getting sick again. New York City stats, we don't want to risk this or that. And I think it all boils down to just not recognizing the humanity of our clients, that they have done something wrong and it's okay if they die in prison.
Yeah, I agree with that. I think there in this country there is some kind of what's the word I'm looking for? Like a blocker that prevents people from really seeing the humanity in those they consider different or other, and so deaths and other things are considered okay. Cook County Jail, which is the jail in Chicago, is one of, if not at one stage, the hotspot in the country for COVID. And at Stateville Prison, where we go into, similar thing in terms of testing. Like, it's hard to know how many people are being tested, but we've had 12 deaths, including 2 that are our students. And so it's hitting the prisons and the jails pretty significantly. And like Stephen said, like they're fearful, and there is this mental health issue of where there's no social distancing in prison. It's been a struggle for prisons and jails everywhere to get any kind of masks and gloves and soap. And so not having that control of being able to look after themselves, they're at the whims of officers, of those who are handing them out their food trays, and are their gloves clean that they're being used? Are there even gloves? Like, there's just no way of controlling it. And so there is this fear of, well, of course I'm going to get it, because whenever there's an outbreak of anything in any of the prisons or jails, it just runs rampant. But this has got a high death rate. So then what does that look like? And for our students, where there's 2 who have already passed from the virus, that just adds a whole layer of even not being able to grieve together, because they're all on lockdown, and unable to interact with each other to grieve and mourn, and to encourage one another in the fears that they all have. It's just a really hard situation. And then for where there's a community where those of us on the outside normally go in, and we can't do that for obvious and right reasons, but that's a whole nother layer of interaction, and where visitors can't come in, so they're not seeing their families, and where access to phones or video visits or any of those things become challenging. It just adds to the layer of mental health and how people are able to process. I think it was interesting when we first went into lockdown, and the guys were all like, we've done this before, we've done months of lockdown, we've done years of lockdown, we've done, but very quickly became, no, this one's different, because there is the fear of the unknown of the virus inside, and then also the fear of everyone on the outside that they're worried about. I think the mental health thing is huge. And also, just even if we go, we don't care about those who are in prison, they can all get it and die, you've still got officers and staff going in and out, and the percentage of cases in them as well is high, and they don't have a choice, they have to keep going to work. But then even just considering them in the equation for their mental health and their physical health, but also they're going in and out. So they're going to be bringing it back out into society as well. So there's just so many layers to all of it, that I think the only way that it's going to stop spreading is that if there can be effective social distancing, which all of the prisons in this country are overcrowded. And that's a generalization. I don't know that all of them are, but I know that it's a high statistic that is. And so looking at decarceration and being able to look at laws in different states and different places, and some bold decisions being made by state and federal officials is the only way that's going to curb it. Otherwise, we're just going to keep having waves and waves of it.
Yeah, and I'm glad we started this conversation by talking about the generalities of the problems with incarceration, because they are playing out in our individual cases too right now. We have a 64-year-old who is a cancer survivor, but also has many underlying issues. He's got asthma, he's got diabetes, he's got all these things. And because of the treatment that he got for his cancer, he also is unable to walk at far lengths without a wheelchair. So he is a great candidate. He is for some kind of relief. He is very vulnerable. And we've been asking anybody who can listen to try to get him out. Unfortunately, he is in there because, separate from some crimes in the 80s and 90s, he got picked up recently on a burglary charge that happened to take place in the house. In New York, that is considered a violent offense, even though he's not done anything violent in this crime, in this charge, in this allegation. And so he's now sentenced to 16 years to life, and he can't get out unless there's some kind of parole. And so everyone views him now as a violent offender, again, even though there's nothing that was violent in the facts here. Because he has a long sentence, because he's being viewed as a violent offender, he's not eligible for any of the releases that might be happening. And then we go back in front of judges, and the prosecutors are arguing that because he's a violent offender, he is a significant flight risk, that he would run away, that he would be, again, he's not really that mobile to begin with. And all these labels, all these characterizations are coming out in the individual kind of litigation and advocacy that we're doing, because they're so rooted in the bigger picture issues.
Exactly, yeah. Wow, there's so much there. Because even, so I've had opportunity this semester through North Park to go into Stateville. And like Vicki said, I went in because I only took the class really because it was going to be at Stateville. And I wanted to be transformed by that experience. And I really have, like, just even think about practical, you can't practice social distancing. You can't there's just basic needs that we would want to have access to, like we can just get our disinfectant wipes and stuff. There's laws, there's rules against that, right? And of what you can have, and then you have to pay for your own things to get those kind of cleaning products in while you're in prison. But with what money? There's, of course, there's money that can maybe be given to you or some quote unquote earn, but not enough for that. So there's just so many pieces that are already, so many broken pieces that this exasperates, and is an example of, they'll be like, well, we'll just take care of it, but you just can't just take care of it. It won't just stop. So talking about the decarceration, is one of the things that I know for Illinois and Restorative Arts has been advocating for. So if you could talk more about that, or some other ways that we could, as staff and students, just ordinary people, what we can do to be a part of changing the narrative and being advocates.
Yeah, I think
Vicki, yeah.
Definitely I'll speak for Illinois, is community, and I would imagine this is going to be the case in every other state, is communicating to the lawmakers and to the governor that you support decarceration, because at the end of the day, there are more often than not louder voices on the other side saying, we can't let anyone out, and those that we can let out, and maybe those who are going to be out in a couple of months anyway, and are nonviolent and are et cetera, et cetera. So being able to provide cover and support for those who are advocating and who are making the laws, and continuing to make phone calls and emails, especially to local representatives who, like, everyone can find out who their local state rep and senators are, and just be on them, because they do need to pay attention to their constituents. And there are advocacy groups on the other side who are very vocal and who are saying other things that we need to counter. And so it's getting people mobilized around making regular calls and sending emails and asking, what are you doing about this? What are you doing about that? To their local representatives. I know for us in Illinois, it's harder to get in touch with the governor at the moment, because there are just so many things on his plate, and but in ensuring that that people are thinking about this and getting people to understand what it means, what it looks like for lack of social distancing in the prisons, what it looks like for me, I can talk about my friends, and I can talk about, give personal stories, and that helps other people to then make phone calls. But I think we have a responsibility, going back to the conversation we were saying earlier, of if we really believe in transformation, and if we really believe in the value and humanity of every person, then we will do all that we can, and we will look at prisons and jails and detention centers, and we will speak out about those places, because people are being dehumanized, people are being treated in ways where they can't look after themselves, and where this virus is just going to continue to run rampant. And so using our voices is the one thing we all can do. And we need to keep doing.
Yeah, I agree with all that. As somebody who's advocating sort of in the legal system for COVID releases and different things, I will say it's more voices is helpful, but I'm very cynical about our policymakers and decision makers doing anything positive on that front, which is not to say that you shouldn't be involved, but to say that getting involved, knowing more, it's all helpful. And I think there's a lot of websites out there. I think there's one, representjustice.org, that will give you some, I think you can find individual information about your state, but just looking at your state's information about what's happening with prisons, what's happening with clemency applications, commutation, particularly, and I think Diana mentioned this earlier, there's a difference between jails and prisons, and I think both need help right now, but prisons are the ones that deal with people who have been sentenced to prison sentences. And I think those are the clients that we work with that are not getting much relief at all, because everyone's comfortable with them already having sentences. But I think more generally, look, if you're somebody who's still on this call or has watched this video up to now, you're already concerned about these issues in important ways. And I think trying to amplify your thoughts and opinions in your own communities, to have these conversations with your friends, with your family, who don't understand the things that we've been talking about, is really helpful, because changing things in light of this crisis is important, but it's the bigger structural narratives that need to be reformed that we need to be talking about.
We have like 10 more minutes. I could ask more questions, so we have 10 more minutes. So I want to invite space for those on the call to ask any questions. Or share any thoughts.
I have a question for Stephen. Actually, two questions. So the first was, you listed a few things like clemency applications and going state by state to see specifically what your state is doing. And I just want to write down what you listed specifically so I can look them up. And then
Yep.
I said, oh yeah, you can.
Yeah, so a lot of ways in which people are trying to just legally to get folks out are around the idea of compassionate release applications. And if you look up in your state compassionate release, you will find alternatives for how decision makers can do good things right now. Some of these methods are like clemency by the governor, commutation by the governor. Different states have different parole policies. Some have medical type parole policies that might be useful. But in most of your states, there will be some organization or many organizations that are litigating, are trying to figure out the mechanisms that people could get out. But generally, yes, clemency, commutation, compassionate release are the main things.
Okay. And then I also want to know if anyone has actually gotten out, because I have a family member and they're nonviolent and their trial's been delayed for over, I mean, we're going to have a trial by jury, which has now been like put off for over a year because of the delays. And I just feel like they're such a candidate for not being in prison because they're unconvicted. So it doesn't give me much hope for people who are actually sentenced for long in prisons, I mean.
That's a really good question, and and thank you for sharing about your personal situation. I'm putting in the chat another website that the prison policy website has a list of all the different responses that have across the country that jails and prisons have done, both jails and prisons, and it gives examples of what different states have done, what different governors have done, and you can check your state to see if your state has done anything with regard to jails, with regard to prisons. There are some places doing better things, and there's surprising places. Arkansas's governor and Oklahoma's governor has done a lot of commutations in comparison to New York or other places. But that link will have more resources on sort of current updates on who is getting out.
Okay, thanks.
Well, John or Alana or Chelsea, or did you have to? Just want to make sure I give space.
I'm just really grateful for you two and what you're doing. I'm exploring now just what the next couple of years might look like to really dive in and be an advocate. And especially in the next few months when I'm so isolated, what that looks like. So just having some of these websites, and there's probably ways of just going online and just keep emailing people in my state government in Maryland. Would that be helpful?
Yeah, absolutely. And I would echo what Vicky said, which is that it doesn't have to be the governor. Your local state representatives are also people to talk to and pressure. And they have more power than you might think. They may not have a lot of power, but it's finding voices in anywhere you can to advocate.
Another piece is even just writing to people who are in prison at the moment because they can't have visitors. And we have a correspondence campaign with all of our students that we started by just engaging those who are in our broader community and churches within the denomination that North Park is part of to write letters. And before they do that, we have kind of a training that they have to do in terms of reading a couple of, reading Dominique's book and then watching some videos, which feature, actually one of them is an InterVarsity video that features a couple of our students. And then we have them write, and I know there's a couple of other groups that are doing a similar type of thing, but if anyone wanted to be part of the campaign that we have, they could reach out to me through Diana and we could set you up with writing to someone.
So if we put because what we'll do is we'll put the contact information for the YouTube and video posting in the comments section or the info section. Is that okay?
Yeah.
Okay, great. Yeah. Yeah, I would encourage folks that would be great, because as a student, I can't even write the students that I was classmates with, just the policy. Yeah. So, Stephen.
No, I think that's a great idea. I was just going to respond to John's question as well, is to one way you can start, the things that we're talking about are pretty vast, but one way to start is even just to look in your state. How many people are serving life in prison? How many people are over the age of 50? And trying to answer these questions will help you start realizing some of these numbers. And as you go through those numbers, look to see if there are stats about the racial makeup of those people in those specific categories and what that says about your state.
Thank you.
It's really helpful. Okay, what final thoughts? As I think you guys started to talk to this, but I'd love to hear your final thoughts. Like changing the narrative. What is one way that you would think that we can be a part of changing the narrative?
I think it comes back to the proximity piece, and to even answer that for, okay, well, what can that look like right now? That could look like writing to someone in prison, and just read. I mean, there are as we've said, there are so many articles and resources out there, and just be reading those and sharing those, and changing who we follow on social media, because or adding to who we follow on social media, following the voices who are advocates in this space and who are sharing things and speaking about things. That's an easy way to find resources regularly, because they'll just pop up on your feed. And I think education in all of this is the starting point, and the piece that will help us to change our minds and our understanding and our perspective, because it broadens it, and it takes us out from just knowing what we know or just having our own experiences to, okay, no, this is something bigger, understanding the history of mass incarceration and the systemic pieces that led to it. We've mentioned a lot of great books, from Bryan Stevenson to Dominique to Michelle Alexander's New Jim Crow. There are a lot of books and resources. There are a lot of people writing. There's a professor called John Pfaff, P-F-A-F-F, who has been writing a lot lately, especially on the violent conviction piece. And so just educating yourself to start with, but then sharing those resources. And I think visit prisons when we can, but in the meantime, write letters, and get to know somebody who is incarcerated, and understand a different narrative that you can then share with others.
What was that author's last name? John?
Pfaff, P-F-A-F-F. I think that's how it's pronounced.
P-F-A-F-F.
Yeah.
Yeah, I would definitely agree with proximity as the thing. And just a few more practical things is, right now when it's hard to get contact with prisons, there are lots of reentry organizations in your communities that are working with people who are getting out. And just to go back to Diane's point at the very beginning, like, I'm an Asian person, Vicky's white, and we have a certain perspective on how we do this. But talking to people who have been directly impacted and trying to figure out, especially in light of COVID, what are the needs of folks who are getting out of prison? What are the needs of reentry organizations who are working with people who are trying to come back to the community? All these service providers, welfare systems, everything that's going on right now has been impacted by coronavirus. And even getting in touch with those organizations to see what the needs are will bring you closer to this world that we as a society try to keep ourselves separate from.
Great. Well, I want to thank our guests, Vicky Reddy and Stephen Chu. You guys have been great. I look forward to this video being posted and highlighting it. It's just really been there's just a lot of richness here around this conversation. So I hope all those who've been able to watch, and thank you those who've gathered, that you will not only receive from this time, but then take it forward, and take one next step in your advocacy for women and men incarcerated. Thanks.